I'm very curious. I know you said you came back to Namibia, but can you like tell us why you chose to build in Namibia, and also what's the market like in Namibia, like the healthcare market? You said a number of things already, like the insurance and all, but because I just walk us through, like, what does the healthcare market like look like in Namibia?
Okay. So why Namibia? I don't have a choice. I live here. Just
Yeah.
it's home. It's first place that I thought of. I live here, right? And I think it makes it's a great place to test because of the population size. If it works here, 9 out of 10 times it will work in South Africa. And if it works in South Africa, 9 out of 10 times it will work in Nigeria. And so the story goes with Africa scale. So, yes, I love here. What's the experience been like? I mean, the reality is that Namibia and what I've seen in other parts of Africa as I traveled, the problems are quite similar. The problems are the same. Malaria, taking lives, HIV and AIDS taking lives, TB taking lives, diabetes taking lives, and the problem is lack of medication, lack of awareness, lack of education, lack of understanding. What do I eat if I have diabetes? Or what do I do if I get infected with malaria? New mom just got a baby. What kind of vaccinations should she give this baby? So the baby can make it into toddler and then become an adult one day. It's very similar problems all across Africa. So Namibia has these problems too. And I think the way to solve it and the way to like close the gap is if there were more entrepreneurs to solving or fighting this problem. I'm of the belief that we at Patient Care will probably only solve 10-15% of Africa's problem. We need more. So the problem is shrunken.
Yeah.
There's matters of education, there's matters of awareness. Where do I go when ABCD happens to me?
Mm-hmm.
Uninsurance rate. Let's just look at some numbers. Nigeria is at 97%, all-time high. South Africa is at 84%, and then Namibia at 82%. And I think and Botswana at 80%. So I think the smaller countries are kind of getting it right. I mean, if you look at Africa, you'll know that Ghana got it right and Rwanda got it right in terms of reducing this uninsurance number and also educating the people and so on. And many other African countries are yet to get there. Not that they won't, I believe they will. There's a lot of amazing startups around, especially Nigeria and South Africa, amazing startups. I just feel that the government should be involved as well. When looking
Absolutely.
at Rwanda, the government was highly involved. When looking at Ghana, the
Mm-hmm.
government was involved as well. So I think the government should also be involved so that people are more educated. And I think the biggest problem is just education, to be honest. I think that's the biggest problem. You ask someone, why don't you have insurance? They don't even know why they need insurance to begin with. They will tell you, no, it just takes money from me. I need that money for ABCDFG. They don't know that they could encounter a huge problem 3-4 years down the line, and then insurance could be the cushion to land on. So I think it's just really education. I mean, Namibia faces the same problem. When you talk to the healthcare professionals here, you hear them say people with diabetes don't know that they shouldn't be drinking Coca-Cola. And you're like, excuse me, I don't understand. You have diabetes when you're drinking Coke, make it make sense. So yeah, I think that's yeah, I think I've hit the nail on the head though, because education is the center of it all. And
Absolutely.
again, how we're trying to solve this problem is by creating educational platforms. It's costing us a pretty penny, but we hope that we'll find the right sponsors as we grow.